Okay guys, so let's continue the next topic in the journal pathology, that is the inflammation. So today we are going to start the next topic that is very important for your USMLE Step 1 exam, and the topic name is inflammation. So first of all, you guys have to understand what is the definition of inflammation, or it simply, you guys have to understand, it is a response to eliminate the initial cause of cell injury. So let's take an example. Let's suppose here is the example of one cell, and your cell is going to be injured from any cause, from any reason, from any cause. So after the cell injury, your body try to repair this cell. So basically, when your body is trying to repair this cell, there are certain kind of inflammatory cells which are produced by our immune system, and those inflammatory cells then lead to inflammation in response to eliminate the cause of cell injury. So it is the definition. So what is inflammation? Basically, inflammation is the response to eliminate the initial cause of cell injury, and it is also, you can say, used to remove the necrotic cell that form from the original insult. So this is the basic definition. Then after that, you guys have to understand, basically the inflammation is a process which allows the inflammatory cells, plasma proteins and fluid to exit the blood vessel and enter the interstitial space. So let's take an example. This is the blood vessel and here is the cell, and let's suppose this cell is going to be injured. So after the injury, your body allows the inflammatory cells like neutrophil, macrophages that are present in the blood vessel. So from the blood vessels, these inflammatory cells plus your complement proteins, these are the plasma proteins, and the fluid which is also present in the blood vessel. So these three things will exit the blood vessel and enter the interstitial space. What is interstitial space? It is a space that is present between blood vessel and the cell. So here it is the interstitial space. So after the inflammation, your body try to exit the inflammatory cell, plasma protein and fluid into the interstitial space. So this is the basic introduction. Then after that, we divided the inflammation into two main types. One is the acute and second one is the chronic. And also you guys have to understand, when the cell is going to be injured, inflammation is also the process which is used to initiate the tissue repair. So let's suppose if this cell is going to be injured, now after the inflammation, your neutrophil come, your neutrophil will fight with the bacteria, whatever the reason, your neutrophil will try to eliminate the inflammation. So basically it is also the process which is used to initiate the tissue repair. So this is also very important point. Then after that, we have to understand the inflammatory process or inflammatory response itself can be harmful for our body if this inflammation will continue for many days, or if this inflammatory reaction is excessive. So what is the meaning of this line? So basically, let's suppose we know that when the inflammation is going to be occurred in our body, during the inflammation there are different kind of cytokines, there are different kind of inflammatory mediators that are going to be produced, and that inflammatory mediators can lead to septic shock. That inflammatory mediators can lead to vasodilation, and that vasodilation can cause the shock. So that's why they mention here the inflammatory response itself can be harmful for the person if that inflammatory response is going to be excessive or going to be for many days, and it can lead to septic shock. And here they mention the examples in which in your body the inflammatory response is going to be chronic, like if you have the prolonged infection like TB, and if you have any autoimmune disease like SLE. These are the conditions in which in your body the inflammatory response is going to be excessive, and that inflammatory response is going to lead to different cytokines production, and those cytokines can lead to the septic shock. So this is about the inflammation. Then after that we have to understand the different signs that are going to be produced in inflammation, and in the exam you will get question from these signs. They will ask from you the mechanism. Let's take an example. Let's suppose they will say you, a person come to you, and this person has trauma, or this person has injury to specific area of the body, and in that area you see the color is you see the color is red, and that area is very warm. They will ask from you what is the mechanism of this redness and warm of that part of body. So first of all, this is the cardinal sign of inflammation, which is called rubor and color. So rubor mean it the area look red, and the color mean it also you can say that area is warm. So what is the mechanism behind this you can say the cardinal sign? So first of all, the redness and warmth of that area is called rubor and color. So what is the mechanism? Basically, when there is inflammation, there are different kind of cytokines that are going to be produced. So during the inflammation there is production of histamine, there is production of prostaglandin, there is a production of bradykinin, there is a production of nitric oxide. So these are the you can say the chemical mediators that are going to be produced during the inflammation. So if the histamine is going to produce, if the prostaglandin is going to be produced, if the bradykinin and nitric oxide is going to produce, they will lead to vasodilation. So let's suppose this is the blood vessel, and after the inflammation, when these chemical mediators are going to be produced, these chemical mediators will lead to these blood vessel dilatation. So this blood vessel will become dilated. It is called vasodilation. So that vasodilation, how it occurred? Basically, these inflammatory cytokines will go to the blood vessel. In the blood vessel we have the arterial smooth muscle. On the arterial smooth muscle, these chemical mediators will work and lead to smooth muscle relaxation. So when your smooth muscle in the blood vessel will become relaxed, your blood vessel will not constrict, so it lead to dilatation. So that's why this is the important mechanism. You guys have to understand what is the mechanism behind the vasodilation, and you know that when the vasodilation will occur, the blood flow to that tissue or that organ of the body is going to be increased, and when the blood flow will increase, that area will become more red, that area will become more warm. So this is the mechanism of why during the inflammation the injured part is looking red and warm. So this is the important mechanism. Then after that we have to understand the other cardinal sign. You guys also feel that when there is inflammation in our body, that area is going to be swell. So what is the mechanism behind this swelling? So first of all, this is the cardinal sign, which is also called tumor. So tumor means it is a swelling at the inflammatory site of the in your body. So what is the mechanism behind this? So here they mention when there is inflammation, let's suppose this is the blood vessel. So when there is the inflammation, first of all you guys have to understand the first thing which is going to be, that is the damage of endothelial cell in your tissue. When the tissue damage will occur, your endothelial cell will contract or disrupt. So when your endothelial cell will contract and disrupt, your blood vessel permeability will become disrupted. So let's suppose these are the endothelial cells which are present inside the blood vessel. Normally these endothelial cells are not going to allow the fluid, allow the proteins to be leak into interstitial space, but when the injury will occur, these endothelial cells will allow the fluid, allow the leakage of protein to move into interstitial space. So that's why they mention here, when the tissue damage will occur, the endothelial cell will contract or will become disrupted. So when the endothelial cell will become contract or disrupted, it will lead to increased vascular permeability of blood vessel. So when your permeability of the blood vessel is going to be increased, the fluid which is present inside the blood vessel, the inflammatory protein, the inflammatory cells, the proteins which are present in the blood vessel, they are going to be leak into the interstitial space. And the question here they can ask from you is, from which side these protein or these inflammatory you can say cells or the protein rich fluid is going to be leaked from the blood vessel into interstitial space. So the post capillary venules, so these are the sides from which the blood you can say the fluid is going to be leak and go into the interstitial space, because it is the inflammatory reaction, and during the inflammatory reaction the fluid is going to be protein rich. So the fluid which is protein rich, that is called exudative fluid. So this is the important point. Then after that, you know that when there is a large amount of proteins in any part of your body are going to be collected, these proteins will increase the oncotic pressure. So let's take an example. This is the blood vessel and this is the cell, and the space which is present between the blood vessel and the cell, this is the interstitial space. So they mention here, when the proteins are going to be leaked from the post capillary venules and go into interstitial space, when they reach the interstitial space, their oncotic pressure will increase. So first of all, what is oncotic pressure? Basically, it is a pressure which is produced by the plasma protein. So normally the plasma protein are present in the in the blood. So here the plasma protein. So during the inflammation, when these plasma proteins are going to be come into the interstitial space, so where the plasma protein will go, there it will lead to increased oncotic pressure. So if these proteins are going to be coming in the interstitial space, when these protein will reach here the oncotic pressure will increase, because here the large amount of proteins are going to be accumulated, or your fluid which is going to be accumulated is protein rich. So any fluid that is protein rich, we call this exudative. And after that, here they mention like how the endothelial cell will contract or disrupt during the inflammation, and these are the important MCQs. During the inflammation in your body, there are different kind of leukotrienes, there are different kind of cytokines that are going to be produced. So first one is the C4, then D4, these are the leukotrienes. Then after that E4, then we have the histamine, serotonin, bradykinin. So basically these are the inflammatory mediators, these are the inflammatory markers which are going to produce during the inflammation. When these markers are going to be produced, they will go to the blood vessel. So in the blood vessel we have the endothelial cell, and these endothelial cells are going to be contracted or disrupted from these mediators. And when the endothelial cells are going to be disrupted or interrupted or contracted from the blood vessel, the inflammatory cell, the plasma protein, the fluid is going to leak into the interstitial space. So when the fluid that is rich in protein, which is also called exudative, is going to be accumulated in the interstitial space, that will lead to increase oncotic pressure. And the important MCQs here is, they can ask from you like from which side the protein rich fluid is going to leak. That is the post capillary venules. Please keep this in mind. This is very important MCQs, and this can also come in the U-word questions when you solve the question of inflammation. So that is about the tumor. Then after that we have the dolor, which is also the pain. In the cardinal sign, dolor mean pain. So again they can ask from you when in your body one area is going to be injured, or when in your body there is inflammation on one side or one point or on one place, why that area is painful. And you guys also know, when there is inflammation in our body or on the specific part of body, that part is going to be painful. And what is the mechanism why that area in the inflammation will become painful? So basically during the inflammation, again there are different kind of cytokines, there are different kind of inflammatory mediators that are going to be produced, and those are the bradykinin, prostaglandin E2 and histamine. So these are the inflammatory markers which are going to be produced during the inflammation. And when during the inflammation these inflammatory markers are going to produce, they will go to the sensory nerve endings. Like let's suppose in our body we know that there are sensory nerve endings in every part of your skin. So when your skin become damaged, or when your skin you can say become injured in those areas which will become injured, there the inflammatory cytokines are going to produce, and those cytokines will go and irritate or sensitize the sensory nerve endings that are present in the injured part. So when these bradykinin, prostaglandin E2 and histamine are produced, these will go and stimulate the sensory nerve endings, and when the sensory nerve endings are stimulated, you will feel the pain, you will get the pain. So this is the mechanism. So the question which they can ask from you in exam, like what are the what kind of inflammatory mediators are going to produce the pain? You have to keep in mind the name of those inflammatory mediators. Then after that we have another cardinal sign that is called functio lesa, which is also called the loss of function. So basically you guys also know that, let's suppose if I mistakenly injured my index finger, and I know that I am not going to take the work from this finger because it is painful, it is swelled, it is red, it is warm. So I am not going to use this part of my body. I will not take the work from this finger. I will use the other fingers to grab anything or to write or to do anything. So basically it is called loss of function. If any area in the body become injured, your body will try to not take work from that part. So basically it is also called inability to make fist due to hand cellulitis. So what is the meaning of this? If you get the inflammation of the hand, like if you get the cellulitis of the hand, then you will not take work from that hand. You will use the other hand and try to do your task from that hand. So this is the example of loss of function. So basically it is the inflammation that lead to impair function of that part of the body. It is only because of inflammation. It is not like the disability or any kind of other thing. It is just the inflammatory response. It is just the cardinal sign of inflammation. So these are the important cardinal signs of inflammation. Let's take a quick review for according to the exam. You guys have to remember the important mediators. Like they can ask from you, what are the mediators that can lead to vasodilation? Histamine, prostaglandin, bradykinin, nitric oxide. Then you have to remember the mechanism. These will go and lead to vasodilation. Then they can ask from you, like, what is the mechanism, through which mechanism the endothelial cells are going to be contracted, disrupted. So you guys have to remember the mechanism and the mediators that are going to be produced. Then after that they can ask from you, during the inflammation, why that area is painful. Then during the inflammation, why that area is functionless, why inflammation impair the function. So basically it is the body response to inflammation, because if that area is injured, if we take work from that area will become more irritated, that area will become more, you can say, inflammatory. So that's why our body will try to avoid that part. So these are the important cardinal signs. Then after that we are going to, you can say, discuss the other important, you can say, the systemic inflammation, that systemic manifestations that are going to be produced during the inflammation. So first of all, everyone know that when the inflammation is going to occur in our body, the person will feel the fever, and in the exam they will ask from you, what is the mechanism, how the fever is produced in the inflammation. And fever, basically it is the systemic manifestation, and it is going to be produced during the inflammation. So what is the mechanism? So basically, let's suppose if the bacteria entered in your body, and that bacteria is going to produce the lipopolysaccharide. These are the pyrogens. These are the, you can say, the mediators that are going to produce from bacteria. And when the bacteria will enter in our body, and after that the bacteria will produce the lipopolysaccharides. These are the different kind of pyrogens, and these will go and stimulate the macrophages, because macrophage, it is the immune cell, and it is going to, you can say, engulf the bacteria to, you can say, to prevent our body from infection. So when the lipopolysaccharide will go and it induce the macrophage will release the interleukin 1 and tumor necrotic factor, and this interleukin 1 and tumor necrotic factor will go and stimulate the COX activity in the perivascular cells of anterior hypothalamus. And we know that when the COX enzyme activity is going to be increased, there is a large amount of production of prostaglandins, and the prostaglandin which is going to produce in the hypothalamus during the inflammation that lead to fever, that is prostaglandin E2, because this is the inflammatory mediator that is going to produce during the inflammation in the hypothalamus, and that inflammatory, you can say, prostaglandin will increase the temperature point in the hypothalamus. And when the temperature setup is increased, when you increase the temperature in the hypothalamus, you will get the fever. So this is the mechanism. The important point is what kind of prostaglandin are going to produce the fever. Basically it is the PGE2. And how the PGE2 is produced? So you guys have to remember, when the bacteria will go in our body, that bacteria will produce different kind of lipopolysaccharide. Those lipopolysaccharides are also called pyrogens. They will go and stimulate the macrophage. When the macrophage will stimulate it, it will produce interleukin 1 anti-human necrotic factor. That interleukin 1 anti-human necrotic factor will go in the perivascular cells of interior hypothalamus, and in the interior hypothalamus, when the interleukin 1 and the human necrotic factor will enter, they will stimulate the COX enzyme, and when the COX enzyme is activated, it will lead to increased amount of production of prostaglandin, and that prostaglandin is going to increase your body temperature. That will lead to fever. Then after that, this is also very important point, leukocytosis. It is also the systemic manifestation of inflammation. So basically everyone knows, when there is inflammation, the white blood cell count is going to be increased. So what is the reason why it is going to be increased? And it also depends on the inflammation. Like if you have the bacterial infection, you will get the neutrophil leukocytosis. If you get the viral infection, you get the lymphocytic leukocytosis. So it means it is a specific type of systemic manifestation which can be produced in each inflammation. If it is a bacterial infection, you will get the neutrophil cell count high. You guys have to remember this, because the predominant type of cell depend on the agent or injury. Like if it is the bacteria, you will get the neutrophil count high. If it is the you can say virus, you will get the lymphocyte count high. If it is the parasitic infection, you will get the eosinophilic count very high. So these are the important, you can say, the examples in which there is a specific type of cell is going to be increased. So here they mention leukocytosis. What is leukocytosis? Basically it is the increased amount of white blood cell count in the blood, and the type of predominant cell which is going to be increased, it depend on the initiating agent or injury. Like if it is a viral infection, you will get the predominant cell lymphocyte. If it is the bacterial infection, you will get the predominant cell neutrophil. So this is the important point. Then after that, you guys have to remember, during the inflammation, there is going to be increased amount of acute phase reactant. So basically these are the proteins which are produced from our liver during the inflammation, and that inflammation may be acute or chronic. So those proteins which are going to produce during the inflammation from liver, those are also called plasma acute phase reactant. So basically these are the proteins that are going to produce after the inflammation, and that inflammation may be acute or chronic. And they ask from you, from where these plasma acute phase reactant are going to produce. They are produced from liver. And who is going to produce these plasma proteins, or you can say the acute phase reactant proteins? Interleukin 6. So this interleukin 6 is, from where this interleukin 6 will come? This is going to come from inflammation. When inflammation in our body, there is production of interleukin 6, and that interleukin 6 will go and, you can say, stimulate the liver. When the liver gets stimulated, it will lead to increase amount of serum concentration of these proteins. So this is the important, you can say, the mechanism behind this. Then after that, here they mention some of the important acute phase reactant that are going to produce in our body during the inflammation. So this is also very important. You guys have to understand what are the acute phase reactant that are going to more produce in our body, and what are the you can say the acute phase reactant that are going to produce less in our body during the inflammation. So let's take the example of those proteins or those acute phase reactant that are going to produce in more. So when during the inflammation the acute phase reactant are going to produce more, it is called positive or upregulated response. So first of all, everyone knows during the inflammation the C-reactive protein is going to be increased. So basically the C-reactive protein is going to be increased. It is acute phase reactant, and it is the hallmark of inflammation, and it helps in the opsonization. It fixes the complement system and facilitate the phagocytosis. Phagocytosis means it help in eating of eating process. Like if the macrophage is going to engulf the bacteria, so that C-reactive protein can facilitate the phagocytosis. Then after that, they say measured clinically as a non-specific sign of ongoing inflammation. So it's mean, if you want to see the inflammation that is you can say still ongoing in our body, you can check the C-reactive protein. If the C-reactive protein is increased, you will imagine the inflammation is still continue. Then after that, we have the ferritin. That ferritin is going to be again acute phase reactant. When it is produced, it bind and sequester the iron to inhibit the microbial iron scavenging. So basically, just remember, the iron is very important for bacteria. If the bacteria want to proliferate or want to continue the inflammation, that iron is very important. So during the inflammation, if our body try to you can say produce such kind of protein that will go and bind with iron, and the iron is not free for bacteria, then that bacteria can automatically be died. So ferritin is going to produce in our body during the inflammation. That ferritin will go and bind and sequester the iron, and when ferritin will bind and sequester the iron is not free for bacteria, so it inhibits the microbial iron scavenging. So this is the mechanism how it helped to subside, how it helped to decrease the inflammation. Then after that, fibrinogen during the inflammation, basically these are the coagulation factors that promote endothelial repair, correlate with ESR. So it's mean in your body, when there is inflammation, there is increased amount of ESR, erythrocyte sedimentation rate, and if the ESR is increased, then the coagulation factor of protein are also going to be increased. So basically, why inflammation fibrinogen is going to increase? As we already discussed, during the inflammation, the endothelial cell will disrupted. The endothelial cell will you can say contract. So basically, you guys have to promote the repairment of endothelial cell. So how it is going to be promoted? It is going to be promoted with the help of fibrinogen. Fibrinogen promotes the endothelial repair. You guys have to remember this. Then after that, we have the haptoglobin. During the inflammation, when the haptoglobin is produced, it binds extracellular hemoglobin and protect against oxidative stress. So again, if your body is trying to protect against the oxidative stress, it means your body is trying to prevent you from inflammation, because oxidative process or oxidative stress lead to increased production of free radical, and these free radical are going to damage your body. Then after that, we have the hepcidin. Again, hepcidin is going to decrease the iron absorption by degrading the ferroportin, and also decrease the iron release from the macrophages. So during the inflammation, you get the anemia of chronic disease, and that is very important MCQs. Why during the inflammation you get the anemia? So basically, during the inflammation, there is a acute phase reactant protein which is going to produce from liver. That protein is hepcidin. So this protein will produce and inhibit the iron absorption. When in your body there is less iron, automatically we know that in the hemoglobin we need iron. In the synthesis of hemoglobin we need iron. So if there is no iron in your body, then there is you can say there is a disruption of hemoglobin synthesis that can lead to anemia. But that anemia is going to produce from inflammation. That is called anemia of chronic disease. Then after that, the hepcidin is also going to decrease the iron release from the macrophages. So these are the important mechanisms which can lead to anemia of chronic disease. Then after that, there is a procalcitonin. Procalcitonin is against acute phase reactant protein, and it increased in bacterial infections. Then after that, we have serum amyloid A. Again, serum amyloid A is going to produce during the inflammation, those inflammations which are chronic, excessive, and that you can say the prolonged elevation of serum amyloid A can lead to secondary amyloidosis, that we already discussed in the previous topics in the first chapter of journal pathology in the growth adaptation. Then after that, these are the proteins which are going to be increased in amount during the inflammation. But again, there are also some kind of proteins that are going to be decreased, that are going to be down regulated during the inflammation. And what are those proteins? Basically, the albumin is going to, you can say, decrease during the inflammation. This is called negative or down regulated. So reduction of albumin conserve the amino acid for positive reactant. So if in your body the albumin is going to be decreased, so it's mean albumin is a protein. For protein you need amino acid. So if you're not going to make the albumin, it's mean you are not utilizing the amino acid. You are conserving these amino acid for positive reactants. Then after that, we have the transferrin. Basically, this is again going to produce in less amount. It internalized by the macrophages to sequester iron. So basically, the macrophages are going to sequester the iron with the help of which protein? Transferrin. You guys have to remember this. Then after that, we have the transthyretin. It is also called pre-albumin. A reduction conserve the amino acid for positive reactant. So it's mean the albumin or the transthyretin, these are the proteins, and the proteins are made up of amino acid. So if you are going to decrease the albumin or transthyretin, it's mean you are going to make the less protein, and if you are going to make the less protein, you are utilizing the less amino acid. So if you utilize these amino acid less for inflammation, these amino acid can be used later on for positive reactants.